Good evening, everyone. My name is Dr. Vaishnavi Pradhan from the team of Voice of Healthcare. It's an absolute honor to welcome you to this special edition of Respire Lung Cancer Awareness, One Voice at a Time, an initiative by Voice of Healthcare supported by NATCO Pharma. Respire is more than just a podcast series, it's a platform for awareness building and for collective action in the fight against one of India's most silent yet deadly disease, lung cancer. Despite accounting to over 5.9% of total cancer cases in India, lung cancer remains under discussed and frequently diagnosed too late. What's even more alarming is the rising prevalence among non smokers and the growing impact in the tier 2 and tier 3 cities where access to early screening and advanced treatment remains a significant challenge. Through this series, we are uniting voices from the across the healthcare spectrum, oncologists, public health experts, caregivers, and survivors to address the burden, burst the stigma, and explore real solutions that can help save lives. This evening, we are deeply privileged to be joined by a leading expert in this field, Dr. Shripad, Senior Consultant and Head of Medical Oncology at the International Oncology Cancer Institute, Aurangabad. With his vast clinical expertise and compassionate approach to care, Dr. Shripad has been at the forefront of not just treating lung cancer, but advocating for better awareness, early intervention, and equitable access to care. Dr. Shripad, thank you for being here. Welcome, sir.
Thank you so much, Vaishnavi, and good evening to all the viewers.
So, to begin our conversation, I like to start by exploring your perspective on the rising burden of lung cancer in India.
Yeah, this is absolutely true that the burden of lung cancer, as the other cancers, has been rising recently in India. The last decade has seen approximately six-fold increase in the number of lung cancer cases in India. The incidence is also increasing in other countries, but India, it seems, there's one more worrisome fact that the incidence of cancer is a decade earlier. So, if our lung cancer is usually diagnosed at the age of 65 or 70 years in other countries, so we can see earlier diagnosis of lung cancer in our patients.
Okay, so having said that, why is early detection of lung cancer so crucial?
I think this is probably the, if you ask me one most important thing about cancer, so it is early detection. So approximately 75 to 80% of the lung cancers are detected at stage 3 or stage 4, wherein the chances of survival of these patients they go very low. If the patients are diagnosed early and they're treated early, in such cases, the survival increases by many fold. The 5 year survival is approximately 50 to 60% if it is diagnosed early, whereas the 5 year survival in advanced cases is anywhere around 5 to 10%. So there's a huge difference between the survival as well as the tolerance of the treatment and availability of the curative treatment. I think early detection is extremely important.
Okay, so if I speak about lung cancer particularly, what are the correct guidelines or the current guidelines for lung cancer screening in high risk individuals?
Yes. So if we want to diagnose a cancer early, the best method is to go for a screening in a high risk population. So, what is the high risk population? So, the standard international guidelines advocate that a smoker who has been smoking for around 20 years, technically we call it a 20 pack years. So, one pack of cigarettes per day for 20 years makes it a 20 pack years. Somebody who has been smoking for this long and is in the age group from 50 to 80, he should undergo a low dose CT scan of the chest. yearly once. So in such cases, the survival has improved, the early detection has improved with this method. In India, I think there should be a little, we should be probably starting it a little earlier, or probably we should be little liberal about doing this screening actually. Since one reason that we have just discussed, that the diagnosis here in India is usually a decade earlier. Second thing, the form of tobacco that the people here consume, or the pollution which is on the rise. In these cases, we don't know the exact amount of the carcinogens that these people get exposed to. So I think probably even not 55 but 45 or earlier should be the case in India to start the screening of lung cancer.
Okay, so as we spoke in the intro part, lung cancer has become more common in individuals who are non-smokers. So can you tell me why is it becoming so common in non-smokers these days?
Yeah. So there are, we can say there are various reasons. Approximately 70% of the cancers they occur in smokers, but then there is rise definitely in the non-smokers as well. So the factors that are responsible for this are the increasing air pollution, which could be a pollution because of the vehicles that we see on the road, but as well as the you may say the household use of fire, or household gases like these are also responsible, which are used for cooking in various rural areas. So these are responsible. Apart from that, there are some mutations or genetic changes that are responsible for it. But all in all, we are definitely seeing the rise in non-smokers as well.
Okay, so what are the risk factors apart from tobacco use that is contributing to lung cancer these days?
So as we discussed, one of them is increasing air pollution, the polycyclic aromatic hydrocarbons (PAH) that we call, or the asbestos that is generated at various sites, increasing number of construction works or repair works, wherein the people get exposed to these chemicals. The use of various biofuels for cooking and all these purposes. So these are probably the main reasons that we can say which are responsible for increasing lung cancer in non-smokers.
Okay, so now that we have understood the risk factors and the allergens that are contributing to lung cancer, I want to understand that what are the symptoms that a patient should never ignore in order
Yeah,
to help in early diagnosis of lung cancer.
yeah. This is extremely. I think this is extremely important. That knowing the symptoms of early symptoms of lung cancer. So usually, the persistent cough beyond 4 weeks, which doesn't go off, hemoptysis, that is blood in sputum, blood in cough that occurs, dyspnea or shortness of breath, increase or swelling in the neck region, or facial puffiness. Sometimes these symptoms, along with uh, unintended weight loss and decreased appetite, which are persistent for weeks. So these kind of symptoms, especially people with high risk situations, where who are smokers, they should be really aware of it. And any one of these symptoms they see, they should seek an advice from an expert.
Okay. Now, since we are addressing the diagnosis and screening part, what do you feel? How accessible are diagnostic tools like low dose CT scan in tier 2 and tier 3 cities?
So I must say the situation is changing in India. So now these days, I can say tier 2 cities and some of the tier 3 cities also. With COVID, we have seen there are CT scans available everywhere now. So we have even to the extent that we have incidentally diagnosed lung nodules or lung masses with the scans done for COVID. Okay. So I think the best use of it should be done. The probably the missing link is the awareness. So awareness, if it is increased, the infrastructure or I think has improved quite a lot post COVID, and we have CT scans available. So low dose CT can be done on a that's a different technique that we use for it. The availability is increased. It should not be a problem.
Okay, so in order to now that we are addressing the diagnosis, screening part, and the landscape of lung cancer in India, what are the treatment options that are available in the current situation?
Yeah. So just as we discussed in the earlier part, treatment of lung cancer depends on the stage at which it is diagnosed. So, if the lung cancer is diagnosed in a very early stage, the mass can be resected and surgery could be one option. But as we already have discussed, that almost 80% of the cases are either stage 3 or stage 4. Most of them are stage 4. So when in usually in stage even in stage 3 we can use a combination of chemotherapy and radiation together for a finite period of time to even try to cure with a curative intent for a lung cancer. But the
Okay,
most of
so
the patients they present in the advanced stage. So in that case, the systemic therapy that we give apart from chemotherapy, we have new options available now and new avenues available like the targeted therapy and immunotherapy. So which have definitely increased the efficacy of treatment as well as reduced the side effects of the treatment.
okay, so now since you have explained that how the treatment landscape has changed for the lung cancer treatment, can you explain the role of the of targeted therapy and how it differs from the traditional chemotherapy that we were giving to lung cancer patients?
Yeah, I think it's quite important. So the conventional chemotherapy that we give, it is supposed to kill the rapidly dividing or rapidly growing cells. So it usually kills the tumor cells which are rapidly dividing. But apart from that, normally in your body, various cells are dividing rapidly, like the blood cells, like the hairs, like the nails, and like the skin and mucosa or the internal covering of the mouth and intestines. So because with the cancerous cells, rapidly dividing normal cells are also attacked by the conventional chemotherapy. We can see mucositis or oral ulcers, and then alopecia or hair fall, or skin changes, or nail changes, or sometimes fall in hemoglobin or fall in blood counts, which may result into fever and some other complications. So this is what conventional chemotherapy works with this principle. But when we use targeted therapy, it precisely targets the mutation which is responsible for these cells growing, unchecked, or these are growing rapidly. There is a reason usually, we find that reason, we call it a mutation, and these drugs precisely target that mutation. So what it does is it does not affect the normal cells, and only the cancerous cells they are killed with this therapy. So the adverse effects are extremely low, whereas the efficacy is immaculate.
Okay, so along with targeted therapy and chemotherapy, as we have already addressed, we also have got immunotherapy. So, can you tell me that what is immunotherapy and how does it help lung cancer patients?
Yeah. So since last probably we may say 6 or 7 years, we have this newer advanced therapy which is just come to rescue of many of our patients. So we have come to know that there is a phenomenon called immune evasion. So the cancerous cells, what they do is they just bypass the normal immune system, and the normal immune system cannot recognize these cells as harmful cells. So they won't kill the harmful cells. But the immunotherapy, it just releases the drugs which are put on by the some of the chemicals released by the tumor cells, which just avoid the immune response, normal immune response from the body. So immunotherapy enhances the immune response of the body against the tumor cells. So this is probably a third important mechanism of action or way of working of a special drug. So in addition to conventional chemotherapy and targeted therapy, we now have immunotherapy also to target these tumor cells or cancerous cells and kill them. So again, it is useful in quite a few number of patients. There are some indicators, some markers wherein we use immunotherapy, which is usually left to an expert.
Okay, so now as we know that there are multiple treatment options that are available. So how do you personalize like treatment plan for different type of lung cancer patient?
Yeah. Uh, as we always say, we have been able to treat a cancer well because we have been able to read a cancer well. So there are various investigations. Now we have come up with immunohistochemistry, the mutation profile that we just discussed about, are certain biomarkers which can predict the response to a particular therapy. So, apart from the routine indicators like the age of the patient, the comorbidities of the patient, what all other diseases the patient has, or what all other medications patient is taking, how fit is the patient. These are the routine ways or routine parameters which we always judge. Apart from that, the newer biomarkers, which can be done on the tumor cells or sometimes even in the blood tests, these biomarkers guide us to precisely select the drug so that the efficacy is good and the side effects are avoided.
Okay.
For
Uh,
example, lung cancer with a EGFR mutation, which is probably which is commoner in India than the Western one. So the EGFR mutation, we test it on the tumor tissue. When we biopsy it, we have that tumor tissue. We test the EGFR mutation. If it is positive, we can give a certain drug, or oral tablet, which can control the disease for quite a while.
Correct. So now that we have understood the treatment options and the screening and diagnosis part, since we are a country of growing economy, so what do you think that how can we have more accessible and more affordable therapy options in India particularly?
Yeah, absolutely true. So this is an integral part of treatment of any patient, especially practicing in a relatively rural part of India or non-metro part of India. This is extremely important. So there are various ways. The government of India and state government, they have come up with extremely good patient assistance programs, and they are really helpful in a vast number of patients. Apart from that, there are various NGOs and organizations which are helping patients work this out. Beyond that, there are manufacturing companies or drug companies which try to provide patients assistance with the drug. And last but not the least, probably the awareness of the disease, the need to act timely, or trying to diagnose a disease earlier, it will save a patient a lot of cost. So rather than delaying a treatment or rather than delaying investigation, if we have certain symptoms like the ones we have discussed, so if the disease is treated early, the cost is low and outcomes are better. So awareness is probably the most important thing and probably the most crucial link, I think.
Okay, now since we are dealing with, you must be dealing with a lot of patients on a day-to-day basis suffering with this disease. So, what is the psychological challenge that patient with lung cancer deal with?
Yeah, I think for that matter, lung cancer and any other cancer, the psychological challenge is huge. It is quite difficult for patients even to receive the diagnosis. So, what I consider important is probably just listening to the patient. Many a times, a careful and compassionate ear can probably solve a lot of problems for a patient. Many a times, patient just wants somebody to listen to his problems and his sufferings. So that solves a lot of things. So as time passes after the initial diagnosis, the patient gets, I mean, gradually gets adapted to it. By the time you gradually introduce him the things that, yes, It's okay. You're diagnosed with this condition. This is just another disease. But then there are treatments, and we can do these treatments. They're safe and they're efficacious, and we can just improve your quality of life. So once you initially listen, later on they would also understand and probably respond to treatment. The role of caregivers is again extremely important. So explaining them the correct diagnosis, the treatment options, the pros and cons of them, and further prognosis, I think that the discussion probably does a lot of work.
Yeah, so you very well covered my next question in the answer, because addressing that, yes, caregivers also play a very important role in fighting against lung cancer. So I think that they
Absolutely.
are the support system for fighting the disease, and it can be cured. So can you address that? Why is there still so much stigma around lung cancer in India?
There are various misconceptions, I must say. The stigma is probably because of lack of awareness. So, yes, probably 2 decades ago or 10, 15 years ago, the therapies which were available, the diagnostic techniques which were available, were not this advanced, which are gradually, these are actually rapidly evolving. I must say they're evolving day by day. So we are getting to know cancer better. We are reading cancer well, hence we are treating cancer well. But probably 10, 15 years ago or 2 decades ago, that was not the case. Diagnosis of a lung cancer was probably given as a death sentence, and that too with quite a lot of pain. That patient knows that now I'm going to go through all this pain. But this has to change because of the previous perception. I think there is a lot of stigma. There is fear of. So you know that probably the time is coming or the death is coming. So we need to just change it. We are probably the agents who are responsible, or we should be taking the initiative to change it, so that not only we treat the cancers at the advanced stage, but also try to detect it early and even screen in patients who don't have symptoms. Right. So I think awareness is again the key.
And also, people who are diagnosed with lung cancer, they have got a lot of shame or maybe guilt in accepting it or telling it in public. So, what do you feel that where are we in terms of public education, or what steps are clinicians taking in order to make them advocate of themselves regarding this?
I think this problem still persists. Patients, they don't want, the first question they ask is, am I going to have hair fall? So that naturally tells others that there's something that is going on. So they want to hide the diagnosis. So it is true. A lot of patients they do consider that hiding the diagnosis, or but then I think again listening to the patient and letting him know that this is just like any other disease. This is just another disease, and we can treat this. Uh, there are newer therapies with which we can avoid adverse effects. Many of the celebrities nowadays they are coming up and disclosing their diagnosis, and probably sending good messages to the media. This disease, but this can be treated, and after the treatment, uh, they have improved, or they are cured, and they're living their normal life beyond the disease. So this message has to be given, maybe communicated initially to the caregivers and gradually to the patient on one-on-one basis, and beyond that, the public education again. The public education about the increasing incidence of cancers. So there are quite a few number of cases nowadays which we probably did not see in the past times. So these people they need to be made aware that the incidence is increasing, we need to be aware that what are the symptoms, and we can treat this, we can early detect this, and we can even prevent this. So public awareness is extremely important. I think there are various ways which are people who are trying to do it and doing it on a uh, very good level, but then we have to keep improving our efforts.
Yeah, so having said that, are there any changes at the policy level or at the policymaker level that can be done in order to make the lung cancer awareness or diagnosis easier in the future?
Yeah. So your question is about lung cancer diagnosis. So for lung cancer diagnosis, I think the standard method, which is evidence, which has a strong data or strong evidence behind it. So low-dose CT scan is one method. Currently, we don't have it as a part of routine screening method in India, but at least for high-risk population, probably I think this is definitely going to help because lung cancer is a huge burden, and I still think, despite being a huge burden, this is probably underreported. So all the cases they are probably not reported and they are not reflected in the numbers. So definitely LDCT is a proven method. Low-dose CT scan of an high-risk individual annually once between the years of 50 to 70 maybe, and in those who have previously smoked for more than 20 years or who are current smokers and not left it. So this should help in two ways. One, that the disease is detected early. Second, this probably is an stimulus or impetus to quit smoking or quit tobacco at that point of time. This is for diagnosis. But then we probably also need some policy changes regarding the availability of tobacco and the restriction of tobacco. I think that's a whole different and huge topic in itself. So that is one important thing.
So now we have covered mostly all the topics covering the public health sector and everything. So if you could share one powerful message with the public, so what would it be in terms of lung cancer prevention and diagnosis?
Yes. So, since we are approaching 31st May, which is a no tobacco day, and we just have discussed that 70% of the lung cancer still are caused by tobacco smoke or tobacco consumption or such consumption. So, first of all, it's best to avoid it. So you won't. There are the 70% chances are cut down just by avoiding tobacco. So that is first and foremost. So tobacco and such products should not be consumed. Second thing, if you have any symptoms that we discussed, you should immediately people should immediately seek an expert advice who can help him diagnose earliest and do the curative intent treatment. And thirdly, even if the patients are diagnosed at a later stage, nowadays we have extremely good therapies which are safe and effective. And at the expert hands, I have quite a few patients who are stage 4 lung cancer and are on oral treatment, and they are doing well for 2, 3, or 4 years. So I think there is hope at the end of the tunnel, and we should, on our part, we should increase the awareness, and people should not be afraid of cancer. Let us fight cancer together and beat it.
Correct. So it was a very insightful session, and thank you so much, Dr. Shripad, for joining us. And I hope through this channel and our platform, we make enough noise and make people aware that how should they get it diagnosed early and not have any shame in accepting it and getting it correctly treated. So thank you so much for joining the session.
Absolutely, absolutely. So, congratulations, Voice of Healthcare and Respire, for communicating this message to a wider public. And so, congratulations and thank you so much.
Thank you so
Good
much.
evening. Yeah.